no exception, delivering nothing but the truth. This is UBAF, UBS, Amis Rigidity. Your news, our business. Live from the University of Baguio, this is Sario Fiesta, your anchor.
And this is Aquino Steven, your co-anchor.
Bringing you the latest and the most wanted news of the hour.
And now for the headlines for Global News. A rare condition has been detected in Baguio City, and this syndrome is called Sjogren'S syndrome. A 40-year-old woman is affected with the syndrome and still knowing what is the main cause. Time check, it's 8:13 a.m. We will be right back after the break. And now we're back.
You're still listening to UBAF.
Here's Cyril Fiesta for the details.
Expertise says that Sjogren's syndrome is a rare systemic autoimmune disease that predominantly affects middle-aged women, and it often manifests in conjunction with other autoimmune diseases, most commonly autoimmune thyroid disease, rheumatoid arthritis, and systemic lupus erythematosus. We tried to have an interview with the woman, but she refuses. However, we also tried to ask about the other condition to one of her family members. They said that they don't really know how this condition started, but they say that they always hear her complain about the dryness of her eyes, and it follows the dryness to her mouth. This is Sario Fiesta reporting. And that was the latest, hottest, and the most wanted news of the hour. Once again, this is Sario Fiesta, your anchor.
And this is Stephen Aquino, your co-anchor.
This is UBAF, UBS, Amis Rigidity. It's all up here.
Game ka na ba?
Game na!
Anim na tanong ang kailangan mo sagutin within 60 seconds. Give me 60 seconds clock. Kung hindi mo alam ang sagot, pwede ka mag-pass. Ang category ang papag-usapan natin ngayon ay tungkol sa Sjogren'S syndrome. Handa ka na ba?
Yes!
Ang unang tanong, sino ang mas mataas na chance na magkaroon itong sakit at tatanong edad?
Babae, 40 to 60 years old.
Dahil ang pagkakaroon ng ganitong pakiramdam.
Unknown.
Ibigay ang 4 na classification diagnosis ng itong sakit.
Schirmer tear test, positive ocular test, saliva gland involvement, and histopathology evaluation.
Sa sakit na ito, meron tinatawag na thyroid symptoms. Anong ito?
Dry eyes, dry mouth, and itis.
Dahil magkakaroon ng inflammation sa parte ng muka, may dalawang glands na hindi nagagampan ng kanilang tungkulin, kaya nararanasan ng dry mouth and dry eyes ng isang tao. Anong mga gland ito?
Saliva at lacrima.
Sa iyong huling tanong, may dalawang klase ng Sjogren's syndrome. Ang una ay primary Sjogren's syndrome ay hindi naugnay sa ibang sakit. Ano ang pangalawang klase nito?
Secondary Sjogren's syndrome. Naugnay ito sa mga diseases such as rheumatoid arthritis and systemic lupus erythematosus or HIV.
Ang tamang sagot sa unang katanungan. Sagot sa pangalawang katanungan. Sagot sa ikatlong tanong. Ang tamang sagot sa 4 na tanong. Ang sagot sa ikalimang tanong. At sa huling tanong, you got 200 points! Ako nga po pala si J.R. Megano, nagbibigay sa iyo at premyo at makihula at makipanalo sa UB Feud.
Yes!
Salamat Dok sa inyo. Laga ay tapat at totoo. Salamat Dok.
Kasama po natin ngayong umaga ang fresh na si Dr. Christine at si Nurse Ashley Nabos, a doctor and nurse of UP Hospital. So Doc, nababalitaan po namin ngayon na mayroong kaso na ng Sjogren's syndromes dito sa ating bansa. Pwede niyo po bang ipaliwanag sa amin ang mga sintomas nito?
Magandang umaga sa ating lahat. Meron nga tayong kaso ngayon na Sjogren'S syndrome at napakabihira lamang na magkaroon ng isang tao at dahil hindi matukoy kung anong dahilan ng pagkakaroon ng ganitong karamdaman at ano ang mga pwede natin gawin. So maaaring makaranas ng Zika symptoms or the keratoconjunctivitis, dry eyes. So the patients will exhibit increased redness and lack of tearing and xerostomia or dry mouth, wherein there is a reduced saliva production may lead to difficulty swallowing. We also have the sleep disturbances are frequently reported and may be related to pain, fatigue, and depressive symptoms. So the sensory neuropathy be present with symptoms such as burning pain in the extremities, numbness, vertigo, and or myalgia. So Raynaud's phenomenon, which involves blood vessel spasms leading to decreased circulation to the toes, fingers, nose, and ears may be reported. And the patients may experience symptoms of pain, fatigue, depression, and anxiety. So we also have the medical management. There is no cure for Sjogren's syndrome and treatment is aimed at symptom management and improving quality of life. Artificial tears, drops such as pilocarpine and ocular ointments such as topical cyclosporine are used for dry eyes. Tears normally drain through the lacrimal puncture to the nose, which can render artificial tears ineffective. Therefore, punctum plugs may be a useful management tool. One systematic review reported that pilocarpine is highly effective in decreasing symptoms of dry mouth by increasing salivary flow. And additional suggestions include eating small frequent meals, omitting spicy, salty, and irritating food, and avoiding smoking, including ends, excessive alcohol use, and drugs with anticholinergic side effects. There is some evidence for the effectiveness of rituximab and interferon. So patients needs to be screened for depression and sleep disturbances, then appropriate referrals made when these comorbid conditions are present.
Maraming salamat, Dr. Christine, sa munting kaalaman. Ngayon ay may babahagi naman sa ating si Nurse Ashley.
So, gaya nga ng sabi ni Dr. Yes, no? Bihira lang ang kaso ng ganito. At bilang isang nurse, bihira lang din kami makikita ng pasyente na mayroong Sjogren'S syndrome. Ngunit kahit gayon pa man, we will give you the utmost care that you will need, such as educate and reinforce the treatment regimen with the patient, especially involving the ocular treatments to avoid eye infections secondary to dry eyes. So, nagkakaroon ng problema dahil walang sapat na kaalaman sa mga self-management techniques upang mabawas ang kanilang nararamdaman. Kung tayo man po ay may mga di ka nais-nais na nararamdaman, magpakonsulta po tayo agad upang maagapan at mabigyan ng agarang paunang lunas. Maraming salamat po.
Maraming salamat, Doc Christine at Nurse Ashley. Marami kaming natutunan sa mga ibinahagi niyong kaalaman. Magbabalik ang Salamat, Doc!
Salamat, Doc!
Views and opinions expressed by the host do not reflect that of the store and its management. Furthermore, the views and opinions expressed by the guest do not reflect that of the host, the show, the store, and the network. Tonight with Boy Abunda.
Now, let's do fast talk with Miss Jamie Banan. Wait, sandali. Kailangan ko nga. Okay, game. Jamie, ano ang tawag sa isang rare autoimmune disease that permanently affects middle-aged women?
Sjogren'S disease.
Ano ang dahilan ng pagkakaroon ng Sjogren'S disease?
Unknown.
Ano ang tried symptoms ng condition na ito?
Dry eyes, dry mouth, tsaka dry lips.
Magbigay ng diagnostic test na ginagamit upang tukuyin ang sakit na ito.
Skimmer, tear test, and rose petal test.
Ano ang lunas sa sakit na ito?
There's no cure in Sjogren'S syndrome, but there's only symptom medication such as eye drops and avoid smoking. Then consult if symptoms persist and get complete.
Thank you, Miss Jamie.
Thank you.
So, this is the pathophysiology of Sjogren's syndrome. The non-modifiable factors that can lead to Sjogren's syndrome are age, such as being 50 years old and older, sex, being female, ethnicity, Japanese, Chinese, African, and American heritage, and the previous diagnosis of other autoimmune diseases such as rheumatoid arthritis and systemic lupus erythematosus. So, the modifiable factors, on the other hand, include environmental factors. This is because environmental conditions, such as unclean surroundings, can lead to an exposure of a person to pathogens. First, it is worth noting that the mechanism of developing Sjogren's syndrome is still unclear and unknown as of today. It is still a subject of research. For instance, the antigen that triggers the immune response is not the same in all patients. Some of the most common antigens include viruses or bacteria, and others have cytoplasmic antigens. These are the ones which are naturally present in the cells of the body, but are mistakenly considered as harmful by the immune system. These antigens trigger the formation of abnormal immunoglobulin G, or IgG. The IgG causes B lymphocyte activation. B lymphocyte activation produce antibodies such as the rheumatoid factor, and also these ones here, SSA, SSB, and ANA. SSA means anti-Sjogren's syndrome related antigen type A antibodies. SSA once again is anti-Sjogren's syndrome related antigen type A antibodies. Next, SSB means it is also similar to the aforementioned factor, which is anti-Sjogren's syndrome related antigen type B antibodies. So yung nabago lang po is type B. And lastly, ANA means anti-nuclear antibodies. So, cytoplasmic antigens trigger autoantibodies such as rheumatoid factor, SSA, SSB, and ANA. These autoantibodies combine with the abnormal IgG. Immune complexes then are formed and deposited at moisture-producing exocrine glands such as those found in salivary and lacrimal glands. Then, immune complexes are recognized by complement proteins. Complement proteins are proteins that are synthesized by the liver and circulate in the blood. Then, the detection of complement protein activates the complement response or the complement cascade. Complement response is also called complement cascade. The complement response is composed of enzymes or proteins. This mediates inflammation and healing and destroys the pathogen detected by the body. In this case, the body mistakes the cells at the moisture-producing exocrine glands as invaders. So the function of the complement response include enhanced phagocytosis, increased vascular permeability, hemotaxis, and cellular lysis, which will be discussed later on. The complement cascade achieves this function by first, the activation of C3 and C5a complementary proteins. The other term for C3 and C5a, C3a and C5a are anaphylotoxins. These proteins are responsible for the inflammatory response and chemotaxis. So first, the inflammatory response is divided into two phases. The first is the vascular response, in which there is the release of chemical mediators, histamine, quinine, and prostaglandin. So once again, the chemical mediators are histamine, quinine, sorry for the typographical error, and prostaglandin. These three chemical mediators cause vasodilation, increased capillary permeability, and increased blood flow to the affected exocrine glands. So, this vascular response causes body responses such as rubor or redness, calor or heat, dolor or pain, tumor or the other term for swelling. Rubor or redness is due to the increased blood present in vessels. Calor or heat is due to the increased metabolism or intake of nutrients at the site of inflammation or the glands in this case. Tumor or swelling is due to the fluid shift to the interstitial spaces. Thus, there is an increase in gland size. Dolor or pain is related to the previous swelling as the moisture-producing exocrine glands enlarge. Nociceptors or pain receptors are stimulated. Leading to the perception of pain. Lastly, there is functiolasa, or the term for the loss of function of moisture-producing exocrine glands. The vascular response mentioned earlier also leads to leukocytosis, or the increased synthesis and release of immune cells from the bone marrow. Some examples of these immune cells are neutrophils. Next phase of the inflammatory response is the cellular response. This causes the migration of leukocytes to the site of injury or the moisture-producing exocrine glands. This migration is what we term as chemotaxis. The neutrophils and monocytes, specifically the macrophages, are stimulated to have increased phagocytosis. This leads us to the next part of the complementary cascade, which is the activation of C3b complementary protein. C3b is concerned with increased phagocytosis of immune cells. Lymphocytes, on the other hand, infiltrate to the previously mentioned glands or the moisture-producing exocrine glands. The increased phagocytosis and infiltration causes cell death. Cell death, which will be further discussed as we move on to the complementary cascade. Also, with the increased function of leukocytes, there is the stimulation of leukocytosis, which was mentioned earlier. The last part of the complementary cascade is the activation of the membrane attack complex, which will be discussed by Angeline.
Next one, the last part of the complementary cascade is the activation of the membrane attack complex. This one. And then, this causes the several complementary proteins. In the membrane attack, the cell phosphate bilayers are disrupted, the moisture-producing exocrine gland that attaches the complementary protein to the cells. In other words, the complementary protein punch the hole on the membranes of the cells. This causes the cell lysis and ultimately cell death. As mentioned earlier, cell death also brought by the action of the immune cells, also known as the phagocytosis of the immune cells. Yan. And also the filtration. As the body detects the decreased functioning cell from the moisture-producing gland, it stimulates the regeneration and the repair. This causes loop since the body will continuously detect these cells as the harmful. And continuously complement and inflammatory responses. And then disconnect in the Punctualisa or the loss of the function of moisture-producing exocrine gland. Autoimmune disorder, healthy tissues can be damaged by the complete activation and resulting inflammatory responses. This is how the Sjogren's syndrome is caused. Yan. Punta na tayo sa Sjogren's syndrome. We'll go to the signs and symptoms of Sjogren's syndrome. But before that, meron tayong dalawang part ng Sjogren's syndrome, which is the primary and the secondary, which come out the other disease. Punta muna tayo sa secondary. Yan, connect dito. The sign and symptom of the rheumatoid arthritis and systemic lupus erythematosus. Yan. Secondary siya, nagkukos siya ng other diseases. Burahin muna natin. And then we'll go to the primary Sjogren's syndrome. There is a present, number 1, dito muna tayo sa signs and symptoms. There are presence of the joint and muscle pain. Ito. And then brought by the inflammatory response spreading to the other organs of the body like the muscle and joint. The nursing diagnosis of this is the acute pain. It can also become a chronic pain if it exceeds 6 months. The other manifestation of Sjogren's syndrome, there is a dry mouth or xerostomia. The signs and symptoms are the buccal membrane fissures, altered sense of taste, dysphagia, and dental caries. The nursing diagnosis is impaired oral mucosa. Next is the manifestation of dry eyes or the keratoconjunctivitis sicca. The signs and symptoms: decreased tearing, grippy sensation in the eyes, burning, blurred vision, and photosensitivity. The nursing diagnosis is meron tayong dalawa, which is the ineffective protection and nursing risk for injury. Next one, the painful intercourse. The signs of symptom is the vaginal dryness or pruritus, and the nursing diagnosis is sexual dysfunction. The next one, or the lastly, second to the last, ito muna, focus tayo dito. It increased the risk for the nephritis, 40%, Raynaud's phenomenon, 20%, and lymphoma, 5%. And then the last signs and symptom, which is the dryness of the respiratory tract. The signs and symptoms include epistaxis, hoarseness, chronic non-reproductive cough, recurrent of the respiratory symptoms, and the nursing diagnosis is risk for infection. It's also worth noting that the having Sjogren's syndrome increases the risk for having nephritis. Itong nasabi ko kanina. Nephritis. Nephritis, Raynaud's phenomenon, and the lymphoma. Yan. And that is the end of the pathophysiology of Sjogren's disease.